All right, so today what we're going to be doing is we're going to talk about anatomy physiology. We've got 3 different topics. Today we're going to be talking specifically to skeletal system. So some of the topics we're going to go, as you can see there, we're going to talk about the structure of the bone, formation, remodeling, homeostasis, go over the divisions of the skeleton as well, and talk about articulations and the other systems there. So basically, and this is important, the 5 primary functions of the bone is basically going to be support, storage, blood cell production, protection, and then leverage. This is going to be our motion and where we're going to be moving and how our body's going to be able to function on there. So we're going to start off with the structure of the bone. So this is also our osseous tissue, or how it comes. This is basically our framework, and we're going to talk about how it builds from starting off with cartilaginous cells and then turning into bone itself. So basically what happens, and again, this part isn't that important for you guys to know, but there's what's called osteocytes that form the mass of the bone. And then there's other forms of bone as well that help to break down the bone, create the bone. It's going to be a mixture of cells that are constantly going. What we find is our body's always going to homeostasis, and the body's always building itself and rebuilding itself. As far as the type of bones, there's basically 4 categories that are out there. Your long bones, which those are going to be like your femur, your humerus, fib bones. Your short bones, which those ones are going to be like in your hands and your feet. We have our flat bones that are going to be like our skull, our sternum, and then our ribs. And then our irregular bones, those are ones with odd shapes or multiple shapes, like our sacrum and our vertebra. So here's an example of each of those, and I just kind of went over those so you can see, and you guys will also have the slides to review as well. But those give you a kind of the breakdown of what those shapes are. Our long bone is going to be one of our most important because it's got a main function. I'm going to stick on this slide for a little bit. So there's different aspects to the long bone. There's the epiphysis, which is basically the ends of the bone. Those are our 2 main portions. We have our proximal and our distal epiphysis based on anatomy. We have our diaphysis, which is going to be our central core. Again, these are very important to know. And then the barrier basically between the epiphysis and the diaphysis is basically called the metaphysis, or we call it the epiphyseal plate when we're talking about pediatric patients. This is that growth plate formation. In adults, that's already fused over, but in kids, an important aspect to know. Then the other aspect we know on here is we have what's called the spongy bone, which is going to be out in the epiphysis. That's going to be where we have a lot of the blood formation, easy access in there, and we're going to talk about those. Whereas the long shaft, which is going to be basically your main protection area, that's going to be this compact bone or very dense bone. So if you think about it, at the end, that long shaft, that's the easiest place to be breaking, that's got to be very rigid, where the other portions with the spongy bone at the ends, that's our articulation, it can have those areas and be building blood cells. An important aspect of this that you need to know as far as becoming a paramedic as well is we do IO access. As we're doing IO access, if we drill into the compact bone, how well do you think that's going to go? Probably not so well into a dense bone. We're getting into the marrow. But that's why when we aim for bones, we're actually going to the spongy type bone, because the needle can go in, it gets access into that area so we can fill fluid into the body. It's great access, and we'll talk about this later on, but that's an important concept to know. And so I talked to you a little bit about that spongy bone and that compact bone. Well, that spongy bone has a big access in the epiphysis, but it does extend all the way down through the canal. And as we go down that canal through the compact bone, that still comes through and works, but to get access to it, we're really dealing with that epiphysis area. As far as our layers of the bone out there, we have our outermost layer is called the periosteum. This is the hard surface which covers around the outside of the bone. This also area is congruous with the tendons and ligaments as they attach to the bone. As we're talking about when we get in skeletal systems and that attaches to the bones, those are the areas that work on. This is our protective area, and then through this we have routes for nerves, blood vessels to get in, and that's where it's going to feed the bone, and then as well as blood that's being produced in the bone comes back out. Our endosteum lines the marrow. That's our most inner aspect. And here's that periosteum again, kind of in a more breakdown. It has basically two layers that it's going. We have this outer fibrous layer and an intercellular layer, and that's where the blood vessels are basically coming in through here, and that's what protects the bones. All right, I'm going to pass through these here as I'm going to get to this aspect. So our major aspect of bones that we deal in with is called our osteons. Osteon is the main cell that forms those bones, and that's where we get fluid coming through. This is what's called an Haversian canal, and it basically is where our artery, nerve, and veins come in contact with the bone. This is where we get calcium exchange, minerals, we get fluid, blood cells that are made, all transported through these areas, but the osteon is the main body of the bone. The cells that come in here, and this is where I talked about which makes bones, there's basically three cells that we're dealing with. Our osteocytes are basically our bone matrix. Those are the bones that's in there at our main area. Now what we have is osteoclasts and osteoblasts, and this is important. Our osteoclast is what breaks down bone. It is a type of cell, and it'll break it down. It does this for a couple reasons. One, it breaks it down to release calcium and release minerals that we need to do. And then right behind that, osteoblasts come up and they build bone. And when osteoblasts build bone, they're basically build that bone area. They become dead at that point in time, and they become osteocytes. So our osteocytes is our main area. Our osteoclasts break down bone. Our osteoblasts build backbone. And those are the three main cells of the bone that we need to know, and those are what's important to know in these areas. So as far as growth, probably about 6 weeks into fertilization is when we start building skeletal tissue. And it starts off basically as a cartilaginous mass that we're dealing with. And then this is going to basically progress from about 6 weeks into fertilization until 25 years of age. So what we'll get is we'll get calcium, gets laid down on this cartilaginous mass that we come, and we're just completely exchanging, and that process is called ossification, where we turn basically cartilaginous bone structure, bone matrix, if you will, laid down on top of that cartilaginous aspect. And again, our babies need to be very cartilaginous. They're very flexible because they've got to come through the birth canal and stabilize. And then once they're born, we have different areas that are building those bones, and those are going to continue to grow. And that bone is going to continuously replace the cartilaginous aspect. I'm not going to get too much into here. I'm going to go break down to this slide. And this slide really is going to explain a lot. So we have our cartilaginous model. This is basically the shape of a long bone, if you will. And then what we have is we have these bony matrix. We'll basically start building in here. You'll start getting blood supply to that central core. Once in there, this is going to start laying down bone matrix. And this is what we call a center of ossification. Now, in the shaft of the bone is our primary center of ossification, if you can see in step 3. So it starts building that main shaft area, or what we call the diaphysis, and that starts laying down bony matrix over the cartilage matrix, and that starts building bone. The next place that we have is basically our epiphysis. These are what's called our secondary sites of ossification, and those are going to happen on either side of the epiphysis. So as that starts building bone on those two ends, what we get is this area in between the primary sections and the secondary ossification sections, and that's our growth area. That gives that bone areas to expand. So it continually keeps growing with cartilage as those bones starts building and it grows, and this is the area that will become our epiphyseal plate, which will then at age 25 will be completely fused, and that'll be the length of our bone, barring other indications. So that's our main growth as far as we're getting length. The other type of growth we get is what's called appositional growth. And that's basically the bones becoming wider. So as we get bigger, we're putting weight on our bones. They also not only grow high, but they have to grow wide to increase with the holding our mass up. So basically, it's the body on the outside is continually has osteoblasts laying down material, and the inside has osteoclasts breaking down. So it keeps building on. Imagine a tree growing and you have all the rings, except for instead of the rings staying wood, The inner ones are breaking down and becoming these Haversian canals and these compact matrix, where that hard compact bone is continually growing out. So as each ring grows, the outside ones become bone, the inside ones become kind of a soft core canal. And that's how it grows wide. So different things that are going to be required for this. To lay down these metrics, obviously we're going to need calcium. So our body's got to have that. We're also looking for vitamin D3. Going to be a growth vitamin in there to get that normal growth and be coming out. The big thing with vitamin D deficiency, if you don't have that, it can cause softening in the bone. It doesn't give that hardening, that rebar, if you will, if you know concrete in there. They can come soft and weak. And this is a disease called rickets, can come from having a vitamin D3 deficiency. Scurvy is the other one. And we talk about the old sailors and that were away from land and couldn't have fruits. And so they were lacking in vitamin C. And scurvy is another aspect. And basically that reduces the osteoblast activity. So we can't build up new bone on there. So the bones end up becoming weaker and don't do. So scurvy and rickets. So remember, scurvy is vitamin C. Rickets is vitamin D3. And then our body always is going under hemostatic mechanism. So our body always wants to maintain hemostasis. We're actually growing all the time. So what we're seeing from this is our body's continually replacing. Our skin is being replaced on a daily basis of shedding cells. And it's constantly, your body is rebuilding itself. It does the same thing with bones. Bones are constantly rebuilding themselves and breaking down, and those osteoclasts and osteoblasts are always working with each other. So we're always seeing a remodeling aspect to keep the bones adapting. As we put more weight on them, we're building them up stronger. Vice versa, we get into older ages and you're not working out, you're not exercising, you're not being weight bearing, you can become osteopenic or weaker because you're not putting those weights on. The body is more breaking themselves down and not building itself up. Other things we'll see as well too is if you're not taking care of yourself, not eating well, your body's going to need calcium and minerals. We see this really, it was a long time ago before we did prenatal vitamins, but you'd see women, if they weren't taking vitamins, they weren't being up on their areas, the baby is going to take most of those areas. So the body would break down the bones and the teeth looking for calcium and looking for other minerals and vitamins that the baby needed, and the baby took priority on that. So that's why we do prenatal vitamins, because otherwise your body will break itself down. And there were women back in the 1920s whose their teeth would be broken down, their bones would become weak. Some of them couldn't survive labor because they basically broke themselves down to take care of that baby and weren't taking vitamins and other things they needed to take care of themselves. So it's a very important concept. This is going to talk about those. I'm not going to keep you into the numbers or go over more except for that aspect. And then the next aspect in this repair is basically going to be fractures and injuries. So our body's a fantastic mechanism. It is designed to heal itself. It's been healing itself well before we became physicians and surgeons and healing these things. So our body is designed to heal itself, and it has different ways it does that. So if we get a fracture, a break into the bone, and I'm going to go into a slide here and talk about this once I get up to my slide here. Great slide. So I'm going to camp on this slide for a little bit. What we do is we get a break into the bone itself. Once we get that fracture, there's bleeding around there. And as we know, with any time there's bleeding, the blood's going to clot on itself. Well, how does the body deal with fractures or injuries? Well, the body basically wants to stop motion. That's how it heals itself. It stops motion, allows itself to heal, and then we can repair itself, and then it remodels. So as a surgeon, what we basically do is we'll put a plate on the bone. We'll put a rod. We'll do other steps, and we'll stop the motion of the bone through our system of mechanisms and get that area to stop. Well, if we didn't have that, our body does it itself. And how it does that, again, is those osteoblasts. Those osteoblasts are on the outer layer. So it builds up what we call a bony callus. Or as you can see on the slide, it builds up a layer around that fracture site and builds up around that area. Bleeding comes around it, it stops over that area, and it builds up this real thickening around the area. Now it's stopped the motion because it's built around those sides. What happens then is osteoblasts on the inside start reforming that bone where the fracture site was, getting it back into the shape that it was. So that bone is healed on the outside. It's nice and stable, has this large callus, or basically internal cast, if you will, Inside, it remodels itself, gets itself healed up on the inside. Once it's shaped, then your body over the next 9 months, the osteoclast will then break down that callus and reshape it back to the way it is. And that's kind of how our body works and how it can repair itself. We basically can do that through fixation and stop it there. As far as aging goes, again, the more we put pressure on our bones, the more we're utilizing them, and we're walking, lifting, doing these type of things, our bone is breaking itself down and building itself up. Without those activity levels and without that stress on it, it basically can become weaker and thinner, and it starts breaking itself down. A process we call osteopenia. Now, osteopenia can also be disease we see more so in women that can come up with that decreased activity than men, but it can happen in both. So the more active you are, the longer you're putting weights and activity and running or motion on there, the better it's going to help for keeping that osteoblastic activity present. But that's how it processes over aging, time, and what breaks down. So let's get into the skeleton and basically kind of go over a few things. And really where I want to go to is this and talk about the division. So the body is made up of 206 bones, which I'm not going to expect you to know. But basically we divided the bones up into two systems. We have the axial skeletal and the appendicular. The axial, you can just basically mean like an axle or a straight line. So this is going to be our skull. It's going to be our vertebral column. It's going to be everything that's basically lined up. Appendicular is everything that is attached to that. So that's going to be our scapula, our shoulder girdle coming up here. It's also going to be our pelvic girdle and our legs coming out there. That's our appendicular. So those are two main aspects that we look at. So axial being basically our straight line. Appendicular is basically everything attaching off to it. And those will be important context to know. So when we're dealing with the axial, we basically have three subdivisions, if you will. One is going to be the skull itself. So that's going to be about 22 bones. I want you guys to know about the skull bones themselves. Those are going to be very important, and I'll talk about those that you do need to know. Our rib cage is actually part of that because it's attached. The ribs attached to the spinal column in the back and our sternum in there. And then our actual spine column is going to be the other aspect. So those are our three main components that are come in here. Now, when we're dealing with the spinal column as well, I do want you to know the different divisions, the cervical, the thoracic, the lumbar, and the sacral, how many bones are in each of those divisions as well. Those are going to be the important aspects that I want you to know. Main function of this is basically going to be supporting the brain and the central nervous system and everything in that spinal column. Different aspects of the skull, and I'm going to see if I can find a good one that I want you to know picture-wise. Here's a good one to come up. The bones of the face and the skull are going to be primary ones I am going to expect you to know. We can see a nice area when we're looking at the bottom, the foramen magnum, which is going to be the main access for the spinal column going in and attaching up into the brain. But as far as the skull itself, I want you to know the different bones that are made up around that. And here's a good one from here. So as we're coming in here, I want you to know the parietal bone, the frontal bone, the temporal bone, the occipital. These are going to be key things that you do need to know. We're also going to talk about the facial bones as well. And let's see if we look right here, and we've got a good one of the facial bones here. So take a look at that from the maxilla, the mandible, the zygomatic bone, where that is. And we're going to talk about the different structures that attach to that as well. Beneath all this, and this is another important thing that I want you to be aware of, is the ethmoid bone and the sphenoid bone. These help form the eye socket. They're very thin, eggshell thin. But the front aspect of those bones is basically going to be forming our orbit around the eyes and kind of the back behind our nose. But on the back side of those bones, those are forming the inside of the cranial portion or our cranial vault around our brain. So what's important to know is if we get any trauma to the head at all, that's a vault. So you get something hit on the back of the head, the occipital region of the bone is very thick. It's hard to break, but that shock wave comes in because it's one solid unit, can break that real thin bones, that sphenoid bone or that ethmoid bone, which is basically right in here. So why is that important to know, as we'll talk about? Well, anytime you get a basilar skull fracture or smash to the head concussion, and you try and put a nasopharyngeal down that nose, right behind it is the ethmoid and sphenoid bone. If that area is fractured, what very well could be, you could actually be pushing that nasopharyngeal right into the brain, or pushing bone chips into the brain and be causing more problems. So anytime we have any suspected head injury, trauma, something like that, we really don't want to stick anything down the nasal passages. Not going to get so much into the sinuses, but I do want you to be aware of the jaw itself, position, the mandible. And then there's what's called the hyoid bone, which is a floating bone. Sits kind of right in there. The tongue also attaches that, and it helps support it there. In kids, what happens is, again, the head comes first, usually in labor. It's supposed to be the way, unless we have breech presentation. Basically, our parietal bone, frontal bone, all those are free floating at the time. Those will fuse later, but they're designed that way so the head can squish and move and get out the birth canal. Once it gets out and baby is born, eventually those areas will fuse together, and we call those areas sutures. So they are initially separate bones which will fuse together, and those sutures basically are what we call a type of a bone joint, even though it's a non-movable bone joint. So those will fuse over time and develop, but I want you to be aware of those. And in kids, we have what's called the fontanelles, or basically the spaces in between those bones, which can really tell us a lot about how they're doing with fluid, especially into the brain. Whether they're dehydrated, we'll see those fontanelles sunken, or if they've got a lot of intracranial pressure or other fluid into the brain, we'll see that basically popping out or sticking out. Again, as far as the vertebral column I talked to you about, there are different shapes. There's some different aspects in there. The cervical region, I want you to know how many bones are in there. And big thing on that I'm going to focus on are the two C1 and C2 and the functions of them. I want you to know the thoracic, how many vertebra in there, and some areas of aspect on that I'm going to talk about, as well as the lumbar region, and then the sacrum and the coccyx. Now, the sacrum and the coccyx are fused bones, but they're made up of a couple different bones. So when we're dealing with the cervical vertebra, thoracic, lumbar, and the sacrum, again, the sacrum bone is actually 5 bones that are fused, and the coccyx is anywhere from 3 to 4 bones that are fused together to form those regions. Not going to go into this curvatures at all, but where I want to go to is into the cervical vertebra. C1 is what's called the atlas. Basically, this is named after Greek mythology of the Titan Atlas, who's holding up the world. Well, basically, that's what your skull is in a sense. That's the world. That's your brain. That's your cognitive senses. So Atlas is what's holding you up there. That's your C1. And that's what articulates, and it does with these condyles and allows you to move your head and to pivot. Now, for that, it rides on C2, which is called the axis. It has what's called the dens joints, which is basically a round circle, and it has a little point that comes up. So C1 can articulate or rotate on C2. So C2 allows us those rotational motions of the head, where C1 basically allows us the nod, the bending of force. C2 does the rotational. And it's the dens ligament that it goes around the odentoid process, and that allows us to do the movement. So C2, rotational, has the odentoid process with the dens ligament around it. C1, atlas, allows that up and down nod. And here we can see the picture of that. This is something I do want you to be aware of. Again, this is a critical aspect of where the neck, in this area, protection reasons. You can look on here, there's almost no body to these ligaments, to these vertebral bodies. They're very narrow and they're designed to hold up the head, but you can see how much spinal column is here. And so any damage to this area can damage the spinal column really easily. And that's why the cervical vertebrae are so important for us to be protecting. Because damage from up here, anything from C3 above, you damage those areas, and you're not only a quadriplegic, but you're basically have knocked out your respiratory drive. The thoracic vertebra, they'll start getting a little bit bigger as far as the body. They've got a nice spinous process down the back. And basically that area is designed for the ribs to attach and come out. They're also designed to be bending and flexible. They're not holding a lot of weight, but they start increasing in size as we go down. Once we hit a picture here, you can see the body starts forming compared to the cervical. we start seeing those spinous processes, and there's definitely areas for the ribs to attach. But this is still allowing that flexible bending, which we get a lot of motion right into that area, and we've got to be flexible in that thoracic region. Once we get down to the lumbar region, look at the difference of that body. That vertebral body's thicker. Again, here we're holding the mass of our weight up. So we have to be a lot thicker on those areas because that's really supporting. And when we're lifting and doing things with our back, these are the main areas. And when we talk about injuries, these are the main areas you get injured because this is where we're lifting and moving our whole body for. So real thick bodies in here. And the column gets narrow because our spinal column, as it comes down, it starts to actually drop off about L1, L2. And then we get just down to nerve roots after there. So we don't need as big of a column. The sacrum is 5 bones that actually end up fusing together, and this forms the back of the pelvis, which holds that into area. So it's a nice flat surface, has canals for the bone to come out. So you can still see the old portions of where the 5 bones were. Now they've fused. You can kind of see the vertebral columns down there. But because these are just nerve roots that are going out each of those canals, there's no reason to have an area for the spinal cord. There's no spinal cord of that portion. And then the coccyx is anywhere from 3 to 4 bones, depending on each person. It's what we call the vestigial tail, if you will. No real function that we're aware of at this point in time. Our thoracic cage, again, this is going to be our ribs that kind of form around. We have attaching ribs. Those are our first 7 pair. And then 8 through 12 are basically what we call our floating ribs as they kind of come down. 11 and 12 are our true floating, but 8 through 10 fuse up and they come right up in this portion here. So they're not actually attaching to the sternum. Only 1 through 7 are really attaching to the sternum, and that's our main area. The sternum is made of a couple areas, the manubrium, which is the large portion towards the top, and then it'll go and broaden down and go to the xiphoid process, which is the little tip right down here. It's where we used to look at doing CPR of rolling the thoracic cage up until we hit that xiphoid process, go 2 fingers, and that's where we knew placement for doing CPR. We don't really do that so much on there. Again, very vascular bone. Another important aspect is that manubrium. It is like the epiphysis of the bone. Why is that important? Well, it's really important for the military aspect. For those people who come across IEDs, have blown off multiple limbs, we cannot get IVs established on them. There's no site for IO because the bones are fractured. We can actually go in that manubrium, do an easy IO, and get access to give them fluids. Another route in here too. And here's just a picture of that thoracic cage. So as you see the sternum and the ribs attaching, those ribs are actually attaching by what's called costal cartilage. So it's basically a cartilaginous attachment between the rib and the sternum. So when we are doing CPR, we talk about, everyone says, well, you break ribs when you're doing CPR. Well, you shouldn't be breaking ribs. What you're breaking is that cartilaginous attachment between the ribs and the sternum, which allows that sternum to be pushed down into there. So these can heal up. It's cartilage, but it can heal itself up. So you're not really doing true damage if you're directly on the sternum, and you're breaking that sternum free with the cartilage. So that's a little bit on the axillar area. I'm going to go ahead and stop there, and we'll talk about appendicular here in a minute.